vascular anatomy of the chin and how to inject it with a filler in a safe way. The major blood supply to the chin comes from two arteries. There is submental artery, there's a branch of the facial artery, comes around on the chin area here, and then there's a mental artery that comes from the mental foramen and it goes right here. Both of these are branches of the external carotid. Also, the inferior labial artery gives a little bit of branching. They can also provide some supply to the chin. But why, with all this diverse blood supply, we still get so many cases of vascular compromise in this area? The problem is how tight the space is. If you take the cheek, look, you can really create some space, and the swelling and amount of filler is not going to create too much extra pressure here on the chin. Try to squeeze and pull out any of this chin area here. You can't. It's a tight space. And many of us were told to treat the chin with a filler by using 3-4 syringes of hyaluronic acid. Even if you can fit in all the filler in there, the additional swelling that's going to occur and a little bit of tightening of the mentalis muscle, which always happens post-injection, will increase that pressure. And because all of those arteries are relatively small, with relatively small arterial pressure, that compartment pressure that you created is going to get them collapsed. That's why the safest technique of injecting the chin is doing few just essential deposits deep on the bone here, and then with a cannula, fan a little bit around that area, and do not do more than 1 syringe at a time, maybe 2 at the most if you're injecting a little bit on the sides as well. If you need more, you can do it in additional session so you can avoid creating all this extra pressure and vascular compromise.